Hello, I'm Tariq Drabu and I'm a specialist in oral surgery at Langley Dental Practice in Middleton, Manchester. Today I'm going to take you through the contents of our basic standard oral surgery tray. I believe that every practice should have basic oral surgery equipment and instruments to deal with any emergencies or planned oral surgery procedures. The way that we set our kits up is that we take it through logically from left to right, from the start to the end of a procedure. So starting at one end, we'll start with the scalpel, going right over to the other end to instruments and materials required for suturing. I'll start with the scalpel first because this is a very important instrument. Most of us are familiar with working with the standard Swan Morton number 15 type blade and handle. However, the handle that I prefer is a micro handle with micro blades. It's a different grip because it's round and pen grip, so it's much easier to hold. Associated with this handle is a different type of blade, and I'm going to show you that now. This is the blade that is associated with this handle, and I'm just going to open it up. This is the micro blade. It's an SM64, available from all dental catalogue suppliers. The way the blade connects into the handle is very easy. It's a simple lockjaw arrangement. The blade slides in, you lock the jaws, and there it is firmly engaged. You can then grip it with a very nice pen grip, giving you fine control and the ability to cut very well. The next instrument I'm going to look at is the Mitchell's trimmer. This has two ends, a sharp pointed end and a round end. The sharp end is very useful for cutting through the periosteal fibres of the gingival crevice, and the round end is very useful for flap raising. The next instrument I use is a Buser periosteal elevator. This again has two ends. A sharp end like an arrowhead. This is very useful for getting into the interdental papillae area and really helps with good flap reflection and minimises tearing. The round end again is very useful for raising the flaps. The next instrument I'm looking at is a Minnesota retractor. This is an absolutely fantastic instrument for flap retraction. The Minnesota retractor has many useful features. First of all, at its working end, it's rounded. It's not sharp and it doesn't press and damage the tissues. Secondly, you have guide rails. So when you slot your surgical drill in here, if it does slip, the first thing it's going to hit is the guide rails and not the soft tissues of your patient. Thirdly, it has a bend here, so you can look straight down into your surgical site, giving optimum vision. Fourthly, it's very easy to hold, ergonomically very friendly to your wrist, won't cause pain and discomfort, very easy to work with. It can be used as a tongue retractor, and finally, because it's double-ended, you can use it for upper flaps as well as lower flaps. A very useful instrument indeed. This instrument is a Fickling's toothed forceps. It's not always easy to find one of these, and it's something I would recommend as an optional extra if you're able to get hold of one. It's very useful for picking bits of soft tissue or roots out of the mouth. When surgical procedure is finished, I do want to make sure that all the bony edges are smooth, so sometimes I will use a bone file just to smooth down any rough edges to make sure they're not sharp to the touch, not uncomfortable for the patient, and will promote good healing. The last three instruments I've got are needle holders, scissors and tooth forceps for suturing. It's very important to get a good pair of needle holders, not just a pair of curved Spencer Wells or Mosquitoes. A good pair of needle holders will give you good control and optimum ability to do good suturing. Here in my hand I've got two different types of toothed forceps. One is slightly wider and one is slightly narrower. It's just a slight matter of preference as to what you would use, but the most important thing is that they should be toothed so that they can pick the tissues up and ensure good suturing quickly and efficiently and neatly. Although the initial capital outlay to spend on an oral surgery kit may be expensive, please do bear in mind that these instruments will last you your practicing lifetime, so it is a one-off purchase. Most of the instruments that I've shown you here are available from your regular dental suppliers at good rates. I hope that you've enjoyed this short video tour of what My Basic Surgical Kit has to offer.